everyone, good morning. My name is Franz Jasmine Swanerap, your student nurse from Davao Doctors College. And today, I am going to demonstrate the eye assessment. So most of all people consider vision as the most important sense. So in this case, in doing the eye assessment, it will help us determine if the patient has any abnormalities in his or her vision. So now, the first thing to do is that to review the client's medical record if available, but my patient do not have any previous medical record because this is her first visit. Then determine the scope of the assessment. This is done for you to know the extent of your assessment, and of course, prepare the necessary equipment such as the Snellin's chart, the black ball pen, the pen light, the opaque card, and of course, notebook. And don't forget to do the hand washing before doing the assessment. So guys, don't forget to ensure client's comfort and privacy. Introduce yourself, verify the client's identity using the two identifiers such as her name or birthday. Then of course, ask how the client would like to call during the assessment. Then, explain the procedure to the client on how he or she can participate during the assessment and provide them the opportunity to ask or raise for concerns. Hello, ma'am. May I come in? Hello, ma'am. Good morning. So, my name is Franz, your student nurse. So, may I know your name?
Okay.
Okay, so when is your birthday?
February 16, 2002.
Okay, so what do you want me to call you?
Anything you want.
Okay, so Althea, I am going to do an eye assessment to you. So, before that, the procedure that I will be doing is that I am going to assess your eyes. And of course, if you can see from a specific angle, in light or in dark. So there are some movement or procedure that you should follow, such as sitting or standing. And of course, following the gestures of my hand and following the gestures of light. So before that, is that all clear or you have any clarifications or concerns?
It's all clear.
Okay, so as you can see, I have closed the curtains so as to provide some privacy. So, the information that I will be getting to you is that secured and safely handed to the doctors.
Clap.
So, assessing visual acuity. So, check for any use of visual aids prior to the test, such as lenses or glasses, and make sure that the client wears it during the test. But if it's a reading glasses, tell the patient to remove it because it can cause blurring of vision. So Althea, are you using some lenses?
No.
Okay, that's great. So now, have the client stand 2 feet away from the Snellin's chart, then cover the eye being tested. Ask the client to read the line until she cannot decipher the letters. So Althea, can you cover your left eye for me? Then read the letters.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, B, E, F, P, O, T, E, C.
Okay, that's good. So, can you cover your right eye for me?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, E, F, P, O, T, E, C.
Okay, so Althea, can you uncover your both eyes now, then read the letters?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, E, F, P, O, T, E, C.
Okay, that's great. So thank you for that. So took 3 readings, right, left, and both eyes. So record the reading of each eye and both eyes and perform the vision test such as the light perception, hand movement, and of course, the counting fingers. if he or she enables to see even the top of the Snellin's chart. So now, Althea, I'm going to perform the hand gesture. So tell me if where direction my hand is pointing. So, where is it?
Or
Okay, this. This.
right.
This. Okay, thank you for that. So now, Althea, I'm going to perform the light perception. So this test indicates if you need prescription lenses or what prescription lens you need to see properly. So tell me if you can see the light, okay? Can you see it? Can you see it? This one. This one. Okay.
Clap.
So testing the visual fields. Face the client directly at a distance of 60 to 90 centimeters. Instruct the client to look directly into the examiner's eye. Then, both hands is about 2 feet apart, lateral to the patient's ear. Then, slowly move the wiggling fingers along with the imaginary ball and in upper and lower quadrant or temporal quadrant until the patient identifies it. Ask the client to tell you if she already spotted your moving hand. So, Althea, tell me if you already spotted my moving hands. So, can you see it? This one. This one. This one. Okay, thank you for that. If the defect is detected, slowly move the wiggling finger into the defect area and then repeat until the border of the defect is defined. Test the other eye for an accompanying defect. But for my case, I haven't seen any defective area.
Clap.
So for the visually inspection for the eyes, so visually inspect for the eyes alignment and symmetry. So inspect for the eyebrows of the hair distribution, alignment, skin quality and movement, and then ask the patient to move her eyebrows. So can you move your eyebrows for me, Althea? Okay, that's great. So inspect for the eyelash for the evenness and the direction of curve. So inspect the eyelid surface and the characteristic. Of course, the relation of the cornea to ability to blink. So can you blink for me, Althea? Okay, so the frequency of the blinking. Inspect for the lower eyelids, then ask the patient to close her eyes. So can you close your eyes for me? So inspect the area over the lacrimal gland and lacrimal sac for swelling. Then ask the patient to look up. So can you look up for me, Althea? Okay. Then depress the lower lid to assess the sclera and babular conjunctive. So now invert the eyelid to assess the peripheral conjunctive.
Clap.
So inspect each iris and pupil carefully. Inspect for the inspect each cornea and lens for opacities, clarity, and texture. So shine a pen light at an oblique position to the eye. So ask the client to look straight. So can you look straight to me, Althea? Okay, so your cornea is brown. And there are no opacities. Assess direct and consensual pupillary reaction to the light. So, assess each pupil's direct and consensual reaction. Darken the room partially and ask the patient to look at distance. Then shine the light on each pupil using this pen light. Then look for any direct and consensual reaction. So ma'am, I will turn off the light for a while, then shine this pen light to your eye. So just look into my eyes directly.
Clap.
So assessing the accommodation. Assess each pupil's reaction to accommodation. So hold this pen light about 10 cm away from the bridge of the nose of the client. Then ask the client to look first at the top of the pen light, then away from the pen light or at the back of the pen light's object. Then instruct the client to alternate his or her gaze from near to far object. Then observe the pupil's reaction. So Althea, can you look at the top of the pen light? Then at my back, vice versa. Okay, thank you so much. Then bring the pen light to the client's nose. So can you look at the pen light, Althea? Okay. Oh.
Clap.
So performing Hirschberg test. So from about 2 feet in the front of the patient, shine this light or shine this pen light or on the pen light from the patient's eye. Then tell the patient to look at it. So inspect for the reaction of the cornea and look for the direct and consensual reaction. So Althea will shine this pen light 2 feet away from you. Then let's see if it or your eyes reacts equally.
Clap.
So performing the cardinal field of gaze test or the extraocular muscle test, assessing the extraocular movement, looking for the normal conjugate movement of the eyes in each direct or any deviation from normal, nystagmus and lid lag and convergence. So watch of the ring of the sclera between the upper lid and the iris as the eyes move up and down. So 2 to 3 feet in the front of the patient and ask the patient to follow a pen light or any object that you are holding while making a wide H in the air. Then, while at it, look for a jerky movement of nystagmus on the lateral gaze on upward gaze. So, Althea, I have this pen light. All you need is to follow this pen light. Okay, so far it's good.
Clap.
So for the test for convergence, ask the patient to look at the examiner's finger or examiner's pen light. Then as it moves towards the nose of the bridge, then check for any convergence. So Althea, just look at this pen light. Then I will gonna observe for any convergence. So for the summary and finding, the last thing is that summarize the information obtained during the working phase, then discuss the findings and possible plan to resolve the health concern if present, then assess the client's understanding of the plan for the further teaching. Then provide the client's opportunity to ask or raise for concern. Then don't forget to thank the client and perform hand washing.
Go.
So hello again, Althea. So in assessing your eyes, it shows that in assessing the visual acuity, your right and left and both sides has 20/20. It means it's all good and normal. Then for the testing the visual fields, in visual fields, ma'am, we can see that at my hands at 50 degrees in your upper field, then 70 degree in your down field, then 50 degree in your nasal field, which is good. So for the visual inspection of eyes, your hair distribution is good. Your eyebrows are symmetrical. You can move it up and down, then which is it is not a problem. So your eyelash is slightly curled, which is normal, and that's good. Then you're able to blink around 50 to 20 minutes, which is, it is all normal. Then in your lacrimal area, there are no swelling. In your conjunctiva, it is a transparent, and your sclera, it is all white and it is normal. So your palpebral, it is pinkish, and the uncongested iris and pupil size are all normal. So your iris is light brown, and you are no opacities as what I mentioned earlier. So for the assessing direct and consensual pupillary reaction to the light, your pupil reacted when the light or the pen light sight in your eyes, and no consensual also reacted. So for the assessing the accommodation, when you look at the object, it constricts, and when you look far away, it dilated, which is normal. Your pupil size is 3 mm, which is it's normal, or it is what is the average. So performing the cardial field of gaze test or the extraocular muscle test, both of your eyes are coordinated, and for the convergence, it is also normal. So keep your eyes healthy, ma'am. Don't spend too much time using gadgets. And of course, if your eyes don't feel well, just come back here and we're gonna do another assessment. So any clarifications or concerns? Okay, so thank you so much for today and have a nice day.
Thank you.